Good evening, all of you. Good evening, Raj, Aditya Gawade, Anand Prakash, Piyush Sharma. Where were you, Anand? Yesterday's class, you are not there. Mohammad Kaif, good evening. Mohammad Kaif, good evening. Good evening. Royal Ratna, good evening. Vamsi, good evening. Insha Sheikh, good evening. All of you, good evening. How are you all? How is the snow there? You're all enjoying in the snow? स्नो की चक्कर में पड़ के ना डोंट रिमूव योर जैकेट्स लाइक दिस टेक सेल्फीज एंड ऑल ओके यू विल हैव नंबर ऑफ निमोनिया केसेस सो वंस इफ यू कॉन्ट्रैक्ट निमोनिया वहां पे तो ट्रीटमेंट पता है यू वोंट इवन गेट ए पैरासिटामोल टैबलेट सो इसीलिए अगेन यू हैव टू कम बैक टू इंडिया सो दैट इज व्हाई देयर इज इनफ टाइम फॉर यू टू एंजॉय दिस स्नो एंड ऑल ठीक है राइट so hope everyone is doing good. In Isukul no snow. Wow. Okay. Right. So 93 students so far. Let us wait for a few more and then let us start the class. Okay. Yesterday class, headache, I was sleeping. Raj, group 16, no personal talks. Sir, are you in Bishkek? I'm not in Bishkek, I'm in India. है ना कल चाय पी रहा था चाय you get in Bishkek, you get in India only. I'm in India, I'm not in Bishkek. 95. Let us thank you so much. Let us wait for 10-20 more students and then we shall start. I'll very soon I'll come to Bishkek. Very soon I'll come. I'll come directly to Isukul only this time. So who is taking anatomy there in Isukul? Is there any faculty right now? I heard there is some faculty. Very soon I'll come, guys, after once these classes gets finished, right? So most probably in the coming month like that, I might come. Okay. So I'll come to the class there. Share this link to your friends, guys, so that they would join it fastly. Srisha Kolai, what? What is Srish? Acha, this question? Yes, you are right. I am going to teach you those things today. Okay? Don't reveal the answer so fast now. Chalo, let's start, है ना? Let us start our classes. So yesterday we were discussing regarding one staining method, है ना? Right. Two important things. Am I visible to all of you? Yes or no? Am I visible? Second thing, am I audible? Yeah? Double okay, right? Done. So yesterday we were discussing few important things, right? Guys, tell to your friends that from today we are recording these classes, okay? So from today we'll be recording these classes, and tell to your friends that attendance is very important. The link, I am not generating this link, okay? The link is generated by the head office, ISM itself. So what will happen is that usually, so they are going to have a record of all the students who attended the class and all. So later on it would happen like, I mean, last year it happened, so I'm telling you the same thing might happen. ये हो सकता है कि at the end, है ना, if you have 1-2 subjects left also, or if there is any little bit fees pending also, right? So they will use this reason for you to expel and all those headaches and all, right? So it is better you attend all the classes. Your attendance is very, very important, because definitely they will note it down. ये तो पक्का है. बाद में क्या होगा, what will they do with that attendance, I don't know, but definitely they will note down the attendance every day. They will have that in an Excel sheet. I have seen personally the Excel sheet where the attendance was given there. Okay, so tell your friends to attend the classes. Yesterday there was 120 students something. Today there are 102. That is why I'm telling. मेरे लिए वेदा मास. What is Veda Mass? I don't know what is Veda Mass. चलो जो भी है, let us start the class now. So yesterday we were discussing about the capsule. I told you capsule cannot be stained, right? So when capsule cannot be stained, two important things are used to stain the capsule. What are those two important things? Anyone? Raj will answer. Raj, answer. What are the two important stains you use to stain the capsule? Usually capsule is not stained, right? So the staining method, whatever is there, this is called as serum. Kahan se aaya? The staining method, whatever you use, you call it as a negative ink stain, right? Very good, Sultan. Very good. One is called as Indian ink and the other one is called as Nigrosen. Okay. Out of two, which is the best? Which is the best? Very good. Which is the best? Very good. Very good. Nigrosen is the best. Which is cheap? That is your Indian ink. And second important thing, I told you that you add serum and there is swelling of what do you call it? There is a swelling of the capsule and all, right? What is this reaction called as? Anyone? Very good, Hasti. Hasti, very good. Cooling reaction. Very good. Tushar, very good. Muntazir, perfect. Very good. So cooling reaction. This is called as cooling reaction. And we have also discussed what are the bacteria where the capsule is present, right? So we discussed something like please shining school, है ना? वो वाला mnemonic use किया था. And we told in asplenics, जिसके पास spleen नहीं होता, in asplenics, right? What are the three important infections they are at a higher risk of? Anyone? Very good, Muntazir. Pin infections. P stands for pneumonia, I stands for influenza, and N stands for Neisseria meningitidis. Clear? Very, very good. Very good. So today what we shall do is that, guys, today we shall, I told you yesterday that we will be discussing, we will be, first of all, dividing the bacteria. You know? We will divide the organisms. Right. We will divide the organisms. What did I tell you? We will divide the organisms based upon four important things. We will divide the organisms based upon the four important things. What are those four important things? One is called as catalase. Based upon the catalase, we shall divide. Okay. उसके बाद based upon the urease, we will divide. Based upon the hemolysis, we will divide. Hemolysis. And finally, based upon the pigment. अभी इनमें से pigment. Now, from these things, whatever I'm telling you, which are useful for your clinical point of view. जब भी मैं clinical करके word use करता हूँ, whenever I use clinical, it means you are higher subjects like medicine, surgery, pathology, and all. So where the clinical point of view, what are the things that are important? Remember this thing very carefully. Okay? For clinical point of view, catalase, urease, these two are very, very, very important for clinical point of view. I will tell you why. I will also make you to do the questions also. Okay, right. Let us start discussing about urease first. Okay. So based upon urease, how are you going to classify these organisms? Based upon urease, you classify the organisms into two different types. Any organism which is releasing urease is called as urease positive organism. Any organism which is not releasing urease is called as urease negative organism. Okay. So one is called as urease positive organism and next is called as urease negative organisms. So हम देखेंगे यहाँ पे कि which are urease positive and which are urease negative. Okay. But before that, I have one question to all of you. Okay. You should answer this question. Okay. All of you just look at this. Right. So you know that this is a female genital organ, right? The uterus, vagina, the cervix, the fallopian tubes and all, right? Now, you also know that in the female genital tract, or it might be male genital tract, whatever it might be, female or male genital tract, what do you know? You know that it is the environment is highly acidic or alkaline. All of you know that the environment is highly acidic, right? Now, in that acidic environment, tell me, how are the organisms surviving? Can anyone tell in that acidic environment, how are the organisms surviving? Any idea? Anyone? Let us say there is a bacteria over here. ये देखो ये bacteria है ना? Now tell me, how is this bacteria surviving in that acidic environment? Anyone? Very good, Muntazir. Very good. Syed Fatima, capsule nahi, not capsule. Neutralizing the acid. Nidhi Jain, you are right. Neutralizing the acid pH. Very, very good. So, ye dekho guys. Why am I telling you this is, in the acidic environment, how will the bacteria survive is that, just look here, you'll understand now. So, normally, let us say, within this urinary urogenital system, you will have a substance called as urea. Urea is a waste material, all of you, right? You know, you will have urea, abundant amount of urea in the male genital organ as in the urethra, in the females and in males, everywhere there is urea. Now, this organism, whatever is there, it will release an enzyme, and this enzyme is given the name urease. What is the name of the enzyme? The name of the enzyme is urease. Okay. So what is this urease going to do? This urease will convert urea into ammonia. This urea is converted into ammonia plus carbon dioxide. Now you tell me, ammonia is acidic or alkaline? What I know is that ammonia is alkaline. Ammonia is what? Ammonia is alkaline. So if this bacteria is releasing more and more urease, then more and more ammonia is released. More and more ammonia is released, the entire urogenital system, the entire female reproductive tract will become alkaline. So in this alkaline environment, happily the organisms can survive and they can cause the infections. Infections matlab kaun sa infections? Infections of E. coli, infections of vaginosis, right? Cervicitis, endometritis. So all these are the infections that are caused. Clear, all of you? So I hope now you understood what is this. Clear? Now, few questions that are all the time asked in the exam. The first important question is that, what is the most common cause of urinary tract infection in women? Batao. In women, what is the most common cause of urinary? Very good. Very good. You're all right. Most common cause of UTI. Okay, you call it as UTI. Most common cause of UTI in women is because of what? It is because of Escherichia coli, E. coli. Okay, not all the strains, only few strains of E. coli. Now, second important thing, most common cause of UTI in sexually active women. Sexually active matlab what is the age group, guys? Batao. In sexually active females, एज ग्रुप क्या हो सकता है सेक्सुअली एक्टिव मतलब? Very good. 18 to 40 years. Okay. 18 to 40 years is a sexually active group. So during this time, the organism which causes the urinary tract infection, all of you are answering right. That is called as, hi Faria, hi. That is called not chlamydia or gonorrhea. That is called as Staphylococcus saprophyticus. What is the organism name? The organism name is Staphylococcus saprophyticus. That is called as Staphylococcus saprophyticus. Okay. Miss you too, all of you. Don't worry, I'll be back. So Staphylococcus saprophyticus. Now the next important question is that most common cause of urinary tract infection in indwelling catheters. In indwelling catheters. ठीक है, अभी क्लास करेंगे बाद में. We can talk. So most common cause of urinary tract infection in indwelling catheters. Can anyone tell what is indwelling catheters? Indwelling catheters matlab, for example, let us say a COVID patient is admitted to the hospital. Okay, okay, let us say a patient who had abdominal surgery is admitted to the hospital. So he will be at least in the hospital for 10 to 14 days. In this 10 to 14 days, do you think he can walk? No. So you need to put a urinary catheter. Yes or no? Now, when you put a urinary catheter without changing that for a long time, don't you think the infection will enter inside through the urinary catheter into the urethra? Yes or no? And cause urinary tract infection. So such catheters are called indwelling catheters. Indwelling matlab jo andar ja raha hai. Either it might be urinary pipe, which you also call it as Foley's catheter, or ek normal saline bhi ho sakta hai. Or yahan pe bhi, you even do a central line. Yes or no? So you even put the central line over here. So that is also an indwelling catheter, right? In some patients, you also put an endotracheal tube inside the trachea here. That is also an indwelling catheter, right? So any of these catheters, indwelling catheters, what will happen is that they can transmit the infection from external environment to internal environment. For example, ये वाला picture देखो यहाँ पे. Look at this picture over here. See, this is the patient. This was a patient with an amputated leg. ये देखो, leg amputation हुआ था. Obviously cannot walk. They kept this catheter. What is this catheter? ये catheter का नाम है Foley's catheter. Okay. But later on, the infection इतना ज़्यादा हुआ कि later on, this is how it turned. You see, this is how the infection turned here, right? So, I mean, these two are not the similar patients. This is another patient who came with the UTI, right? So what I'm telling you is that most common cause of urinary tract infections in those patients who are having these indwelling catheters is Pseudomonas aeruginosa. Okay. Third important thing, most common cause of UTI in indwelling catheters. Indwelling catheters. So that would be your Pseudomonas aeruginosa. I already repeated about Pseudomonas aeruginosa previously, if you remember. है ना? Everyone is clear with that? Sultan, you are clear now? Yeah, Sultan? Right. Very good. Now, another important thing I want to tell you here is that, see, whenever you are doing the MCQs, okay, MCQs of USMLE and all, okay, clinical MCQs, okay, let us take it as clinical MCQs. In the question, they will not tell you that patient's urine is having full of bacteria and all. They will only give you two hints. One is called as within the patient's urine, the nitrite test is positive. The leukocyte esterase test is positive. If they give you leukocyte esterase test is positive, nitrite test is positive, it means within the patient's urine, there is bacteria living there. तभी वो positive हो सकता है. Okay. Whenever you look at a question, in the question, if you see the urine profile down, urine profile जानते हो ना, RBC कितना है, pus cells कितना है, what is the pH, what is the turbidity and all, you will see all those things down list. In that, first thing you need to look leukocyte esterase test is positive or not, nitrite test is positive or not. What are the two things? The first important thing is you have to look for leukocyte esterase test positive. We will do the question on this. Second important thing is nitrite test positive. So leukocyte test positive or nitrite test positive or not, you should see. Sir, what is this nitrite? Simple thing, don't write it down. Urine में ना nitrates होंगे. There are nitrates in the urine. Okay, normally in your urine, my everyone's urine, there are nitrates. अगर urine के अंदर infection है, if within the urine if there is infection, This infection, this bacteria will convert nitrate into nitrite. You're getting it? Normally you have nitrates which are converted to nitrites with the help of the bacteria. If it is converted to nitrite, it means there is bacteria. That in that way you can decode it. All of you are clear till here before we proceed on to the questions? Everyone, tell me very fastly. Everyone is clear, right? All the 115 members in the group, everyone is clear? Very good. Now look at these questions which were repeated previously. Okay? Now look at these questions very carefully, guys. Don't hunt for an answer. This is what I tell all the time. ये देखो, 22-year-old sexually active female. Sexually active group क्या होगा? Someone already told 18 to 40 years, है ना? So it means she will fit into a sexually active group. 22-year sexually active female presents to the emergency department in severe pain. ठीक है? She states that she has significant abdominal pain that seems to worsen whenever she urinates. ये देखो, one common complaint which is given by any patient who is having urinary tract infection is, doctor, whenever I'm urinating, I feel burning sensation. This is called as burning micturition. What is this you call it as? You call it as burning micturition. So this is a common complaint of any patient with urinary tract infection. Keep this thing in mind. So this seems to have progressed over the past day and is accompanied by increased urge and frequency. The emergency physician obtains a urine dipstick which demonstrates the following. Urine dipstick, I have already a video on YouTube telling how do you do a test of urine dipstick. Okay, so if you want, you can watch that. Specific gravity, we don't know specific gravity क्या होता है ना? Just leave this thing. Leukocyte esterase is positive. Leukocyte esterase is positive. This is one sign that patient is having UTI. Second, protein trace, pH 7, nitrate is negative, RBC is negative. Fine. A urease test is performed, which is positive. ये देखो, a urease test is performed, which is positive. What do you mean by this? It means this organism is a urease positive organism or a urease negative organism. बताओ, ये urease positive organism होगा क्योंकि it is releasing the enzyme called as urease. What is the most likely cause of urinary tract infection? So three things I understood. She is a sexually active female, right? She is having burning micturition, which means UTI. Her urine profile shows leukocyte esterase positive and urease test is positive. So now what will be the organism in a most common cause of UTI in a sexually? Very good, Vraj. That is your Staphylococcus saprophyticus. So this would be your answer. Staphylococcus saprophyticus is your answer. Hope you are clear with this. This is how the questions will be asked. Okay. So that's why I all the time keep on telling that what I keep on telling, batao. I all the time keep on telling that having concept is very, 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 very important. Okay. So look at the next and last question over here. 72-year-old man presents to the emergency department by ambulance with altered mental status. Altered mental status matlab confusion mein. Okay. The man has a history of prostate cancer. Okay. Which was treated with transurethral resection. Okay. He now has chronic indwelling urinary catheter. Ye dekho. He now has chronic matlab from a long time. Okay. I will tell you, Fatima, what are the bacteria names of these bacteria which cause these infections and all in a minute. Okay. Chronic indwelling urinary catheter due to urethral strictures. In the emergency department, the man's vitals are heart rate is 89, blood pressure 120/70, 37. Urine analysis demonstrate leukocyte esterase positive, which means he is having UTI. Urine cultures अभी नहीं आया, pending है. What is the most likely organism? बताओ. Most common cause of UTI in a patients with indwelling catheters. What did I tell you? Very good. Pseudomonas aeruginosa. Pseudomonas aeruginosa. So I hope you all understood this thing, right? Now what we will do is that let us see what organisms release urease. Okay. So just remember the mnemonic P chunks. This is the mnemonic which I have taken from the USMLE first aid. This is P chunks. P stands for Proteus. P stands for protease. C stands for cryptococcus. C stands for cryptococcus. H stands for H. pylori. H stands for H. pylori. U stands for urea plasma. Urea plasma. N stands for nocardia. Nocardia. And K stands for Klebsiella. Klebsiella pneumoniae. Okay. And S stands for Staphylococcus epidermidis. Staphylococcus epidermidis. Okay. Now, these are the organisms only they are asked in the exams most commonly. But ek cheez yaad rakho ki this protease, whatever is there, one important thing you need to remember is that this protease, if it is entering into your body, this would form some stones within your body. Okay. So these stones which are formed in the urinary tract, these stones which are formed in the, very good, very good. These stones which are formed in the urinary tract are called as struvite stones. These stones are called as what stones? These stones are called as struvite stones. ये चीज याद रखो बस, ठीक है? All of you just remember this thing. So you understood these things. Before I move on to the next important one, all of you understood this thing. All of you look at this picture. This is a struvite stone which is looking like a ginger, right? So this is your struvite stone. If you look at this picture and ask, these stones are most commonly formed by a urease positive organism. What is that? Will you tell it as protease? Right? Will you answer it as protease? Yes or no? Very good. कौन सा क्वेश्चन सुल्तान? कौन सा क्वेश्चन? See, ये वाला क्वेश्चन में सुल्तान, you just need to understand here two important things. पेशेंट को ना, इन दिस क्वेश्चन द पेशेंट इज हैविंग प्रोस्टेट कैंसर, ठीक है? सर्जरी हुआ था, होने के बाद दे हैव केप्ट ए पाइप and he is admitted for a long time, and now he is having urinary tract infection. He is asking what is the cause of this urinary tract infection. So previously already I told you here that most common cause of urinary tract infection in indwelling catheters is Pseudomonas aeruginosa. So that would be the answer over here. Clear all of you? Now, second important thing is based upon catalase. Okay, based upon catalase, how do you classify the organisms? Same thing, agar catalase release ho raha hai, this is called as catalase positive organisms. If catalase is not getting released, this is called as catalase negative organism. Okay, now one very important thing I want to tell you here, that whenever you get a hurt, okay, whenever you are injured, you know that you have got endothelial cells like this. All of you know that you have got endothelial cells. Whenever you get Sir, the one before this urease positive is another organism. What organism? Right? What organism, Fatima? All the organisms other than these are urease negative organisms. Okay, Janvi, all the organisms other than these will be urease negative organisms. Okay, I'm going to only tell you which are positive. Clear? Right. So obviously staph saprophyticus also I did not write here, which means I have already written previously. That is why I did not include it in the mnemonic over here. Okay. Right. So one very important clinical point I want to tell you here is that whenever you get injured, all of you know that your endothelial cells along with the blood vessel, everything is ruptured, everything is damaged. ये देखो, ये damage हो गया यहाँ पे. Right? Now, when it is damaged, from this is the point where the blood will ooze out. All of you know. Now, what I'm telling to you, listen carefully. Normally, what happens whenever you have injury, you add hydrogen peroxide. When you add hydrogen peroxide, what you see there, you see a lot of foam there. Basically, you see a lot of foam. Actually, what is this foam? How is this foam happening? The reason is that whenever you add hydrogen peroxide, kya hoga? Already these endothelial cells are broken. From these ruptured or broken endothelial cells, from these ruptured or broken endothelial cells, an enzyme is released, and that enzyme you call it as catalase. What is that enzyme called? Catalase. Okay. What this catalase will do? Now you have added what? Now you have added hydrogen peroxide, right? This catalase will convert this hydrogen peroxide to water plus half mole of oxygen. Half mole of oxygen. अब तुम बताओ, you take water, you take oxygen, add both of them and mix. What do you see? You see foam. What is foam consisting of? Foam is consisting of bubbles, air bubbles, oxygen, and water. Yes or no? That is how the foam comes. One more important thing you need to remember is that never ever add hydrogen peroxide to deep cut wounds. Okay? Never ever add hydrogen peroxide to deep cut wounds. Can anyone tell why only new students should answer? New students ये answer करना चाहिए, not Muntazir, not all the old students. New students should answer why deep cut wounds पे you cannot add hydrogen peroxide. बताओ. Yeah. Why you cannot add? Foam बन जाएगा. Foam तो बनेगा ही. Foam will definitely happen. Any other answer? See, why am I telling deep cut wounds? The reason is that deep cut wounds matlab the structures which are present deep inside your body. अभी ये बताओ, all of you look, not burning sensation Vinay, just apply small logic here. Arteries which are on the top, right? When I cut my hand like this, I will have bleeding, है ना? वो blood कहाँ से आ रहे? Deep arteries or superficial arteries? You know superficial arteries and veins. Yes or no? Now arteries which are deep are the diameter of that arteries is very the diameter is much more, right? And these arteries are very thick. For example, abdominal aorta le lo. Abdominal aorta, is it small, thin, wire-like structure, or the diameter is more big? The diameter is bigger. Take femoral artery. Femoral artery bhi itna mota hoga. Take radial artery. Anatomy I've taught you guys, right? Radial artery. You know, here we have got brachial artery. Here we have got radial artery, and here we have got ulnar artery. ये arteries का diameter कैसे होगा? What is the diameter of these arteries? The diameter is much more larger, है ना? So in this thick diameter, what you do is that if you are adding hydrogen peroxide, what will happen? More air bubbles are formed. You're getting it? You're getting it? When these arteries are cut off, more amount of catalase will be released, more air bubbles will be formed. And these air bubbles, let us say this is an air bubble here. ये देखो ये air bubble है. और ये दूसरा air bubble, तीसरा, fourth, fifth air bubble. What will happen? All these air bubbles will join together and form a very big air bubble. And this would lead to a condition called as air embolism. ये air bubble क्या करेगा? This will obstruct the blood vessel. When it will obstruct the blood vessel, the blood cannot pass. If this obstruction, if these air bubbles are going to the lungs and obstructing there, do you think lungs will work? Do you think lungs are receiving the blood? No. There is an embolus there. There is an obstruction there. So this condition you call it as air embolism. So patient within 10 to 20 minutes he will die. Okay. So that is why never ever add hydrogen peroxide to deep cut wounds. Only add hydrogen peroxide to superficial wounds. Clear all of you? Right. Next important thing is that, okay, let me write here is that air embolism. Now, you get an injury, you go to a doctor. Now he is the one who will plan the treatment, right? So doctor is the one who will plan the treatment. So he plans. He plans क्या होता है? H stands for H pylori. H stands for H pylori. E stands for Escherichia coli, E. coli. Okay. P here stands for Pseudomonas aeruginosa, Pseudomonas aeruginosa. L stands for Listeria. Wait a second, about listeria we have already talked one very important thing है ना, previously एक चीज बात किया था listeria के बारे में. What was that? You remember that I told you that all gram negative, yeah, tumbling motility, very good Muntazir, it is showing tumbling motility. And I told you Endotoxins are released by only gram-negative bacteria except Listeria, which is a gram-positive. If you remember, yesterday in class we discussed, right? Listeria. Next, A stands for Aspergillus. A stands for Aspergillus. N stands for Nocardia. And S stands for Staphylococci. Staphylococci. So these are the organisms which are urease positive. These are the organisms what? Which are urease positive. Everyone is clear so far, all the things which I have discussed so far? Yes or no? Be very fast. Yes, if you are yes, then I'll proceed on to the next. All 111 members are there, only few are alive here. I consider only you are alive. Baki sab, Moin Khan, Siddiq, Anibur Rahman, Deekshita, Ajmer Anas, Aisha, Afsan, right? You know that I still remember your faces. I still remember your faces. Vraj, I know you. Specs, you used to sit backside, right? With your friends. Drashti, I remember you guys. Right. Memory power thoda zyada hi hai, right? Chalo. Now, the next important classification, what I told you, catalase ho gaya, urease ho gaya, right? And I have also told you, we will divide the organisms based upon pigment producing, right? Which organisms they release the pigment, based upon that we will discuss now. So, we will discuss based upon pigment producing bacteria. Pigment producing bacteria. You know, some bacteria release some kind of pigment. We shall see all of this. Now, first, all of you now pay attention. Point number one. Point number one, just look at this picture. Right. You know, this is your mandible over here. बस करो, ठीक है? Completely अलग अलग चीजें है ये, है ना? So ये देखो. So look at this. This is the mandible. Now in this mandible, few important things you need to know, that above this, right? This is called as the facial region. ठीक है? Mandible के ऊपर, this is called as a facial region. Beneath the mandible, this is called as your cervical region, right? So beneath the mandible, this is called as your cervical region. Why am I telling you this? Is that there is a specific bacteria. Okay, what this bacteria will do, you know, this particular bacteria will cause abscess. All of you know abscess kya hota hai na? It would cause abscess above the mandible. It would cause abscess below the mandible, in the facial region, in the cervical region. So what kind of abscess you call it as? Cervicofacial abscess. Okay, and this abscess is caused by an organism called as Actinomyces israeli. What is this? This is called as your Actinomyces israeli. So can I call this kind of condition as cervicofacial actinomycosis? Right? Cervicofacial actinomycosis. Right. So all of you look here. This is caused by Actinomyces israeli. This is caused by what? Actinomyces israeli. And Actinomyces israeli is going to cause what? It is going to cause abscess in the cervical and the facial, cervical as well as the facial region. So you called as cervicofacial actinomycosis. Very good. Cervicofacial actinomycosis. Right? Don't worry. Whatever lectures you have missed, just message me after the class. I'll send you one link. ठीक है? ऐसा नहीं है कि अभी मैं मिस हो जाऊंगा, है ना? ऐसा नहीं है कि you will off the lecture right now. For tell to the remaining students also, attendance is important. ठीक है? Those who have missed, message me after the class. I'll sort out. So what I'm telling you is that when you go to a doctor with such infection, what he will do, he will pinch this area, right? He will completely pinch this area. Now when he will come, when he's completely compressing this area, the pus will come out, and if this pus you put it under the microscope and see, you would see yellow sulfur granules. ये देखो ऐसे दिखेगा. This is how you see this, look at the pus, right? First you go to the doctor with this condition, है ना? ये देखो, in this patient, can you see there is a problem in the facial region, there is a problem here also, you see. So can I call this as cervicofacial actinomyces, right? This is called as cervicofacial actinomycosis. So when I go to the doctor, this is how it looks. So this type of granules over here is called as yellow sulfur granules. Yellow sulfur granules. So this is what is called as your yellow sulfur granules. So first pigment that is released by actinomyces israeli is what? Yellow sulfur granules. Clear all of you? Everyone is clear with this? Right. Coming to the second important thing. What is the second important thing? The second important organism is Staphylococcus aureus. Staphylococcus aureus. ठीक है? Aureus मतलब gold. Aureus मतलब क्या होता है? The meaning of aureus is gold. Okay. So Staphylococcus aureus releases a golden yellow color pigment. Here on the right side, you can look at the image that there is a golden yellow color pigment there, right? So that particular golden yellow color pigment which you can see there is called as what? Is released by what? Staphylococcus aureus. So this is your golden yellow pigment. So two important organisms, Actinomyces israeli, what did I tell you? Yellow sulfur granules. Second is Staph aureus, golden yellow color pigment. If you see any agar plate with golden yellow color pigment, that is Staph aureus. Okay. Coming to the third most important organism, that is your Pseudomonas aeruginosa. Pseudomonas. That is what? That is your Pseudomonas aeruginosa. Now, Pseudomonas aeruginosa releases four important colors. Okay, four important things. What are these four important things? Just remember with a mnemonic, CV Raman. CV Raman. What does this CV Raman? C stands for pyocyanin. C stands for what? Pyocyanin. Next, V stands for pyoverdin. What is V stands for? Pyoverdin. Uske baad, next we have got R. R stands for pyorubin. Pyorubin. And finally, M stands for pyomelanin. CV Raman. Okay. Now, what are these? Pyocyanin, verdin, rubin, and pyomelanin? These are the four important pigments that are released by this bacteria, Pseudomonas aeruginosa. In this, pyocyanin, cyanin matlab which color hoga, guys? Cyanin in the sense it is blue color. So pyocyanin is a blue color pigment that is released by this bacteria. Okay. Pyoverdin kya hoga? Pyoverdin is a green color pigment. Okay, pyoverdin, you know, biliverdin. Biliverdin is a green color pigment. So pyoverdin is a green color pigment. Next, pyorubin kya? Rubin is red. So it also releases a red color pigment. And finally, pyomelanin. Melanin kya hoga tha? Melanin in the sense it is brownish black, है ना? So it is brownish black pigment. Brownish black pigment, that is your pyomelanin. So these are the four important things which I want you to remember at any cost. Blue pigment, green pigment, red pigment, or brownish black pigment. But most of the time it releases, most of the cases it releases only one kind of pigment, that is your pyoverdin. Most of the time it will release pyoverdin. Okay, pyoverdin. Clear all of you? Now all of you look at this wound here. Now ये बताओ, ये wound देख के बताओ कि कौन सा pigment release हुआ यहाँ पे? Which pigment is released? Anyone? Within this wound infection, which pigment is released? Very good. Pyoverdin. Pyoverdin is released. You see on the right side also. You see on the right side, you see this, right? What is this? This is green color pigment that is released by Pseudomonas aeruginosa, right? I'll show you the cases which I got in the hospital. ये देखो. You see this? These are the ulcers which are formed, है ना? ठीक से इसको they have not done in the local hospitals. They have not done a proper dressing and all. So the infection, there is a lot of infection right now. ये देखो green color, everywhere it is completely green, 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 है ना? यहाँ पे भी देखो, you see green everywhere. अब ये बताओ which pigment is released? That is pyoverdin. Which bacteria is releasing this pigment? Pseudomonas. Pseudomonas क्या होगा? The bacteria that is releasing the pigment is Pseudomonas aeruginosa. Very good. So how will you know the diagnosis? Diagnosis कैसे पता लगेगा? Simple. You take this one. You take the culture of this. Culture कैसे लेना है? You take you see earbud, है ना? Earbud जैसे ऐसे there are longer sticks. Okay, on both the ends you will have this cotton. So what you do is that you take that, you rub it little bit on the wound, put it in the test tube, send it for the culture. Okay, they will culture the organism. And last organism which you need to know is this particular one, which is red in color, right? So this red color pigment releasing organism is called as Serratia marcescens. Serratia marcescens. So red color releasing pigment is called as Serratia marcescens. So what are the four important things we discussed, guys? Ek Actinomyces israeli, which pigment? Very fast, yellow color pigment, right? Yellow sulfur granules. Next, Pseudomonas, not Pseudomonas, Staph aureus, which pigment? Staph aureus is which pigment? Golden yellow, very good. Golden yellow color pigment. Pseudomonas aeruginosa, CV Raman. Pyocyanin is blue, pyoverdin is green, pyorubin is red, and pyomelanin is brownish black color. Okay, and red color pigment that is released is Serratia marcescens, where it releases red pigment. Now let us see what are the questions that were previously asked on this. Okay, let us look at these questions. Two questions were asked previously. देखते क्या है ये. 37-year-old woman presents to her primary care physician after returning from her honeymoon in Cancun. Right? A few days ago, she began to notice an eruption of small red bumps that cover her torso, back, and buttocks. You know? The patient first thought she had acne. You know acne, what is acne? So the patient first thought she had acne, but became worried when the rash continued to itch. Okay. Culture yields green color pigment, which is the most likely organism which would cause green color pigment. Very good, Nadeem Alam, Syed Fatima. Very good, very good, very good, very good. So that is your Pseudomonas aeruginosa. Clear, all of you? Next important thing. 52-year-old man is brought to the emergency department after being found down in the sidewalk. On presentation, he is found to have overdosed on opioids. So he is given naloxone and quickly recovers. Naloxone क्या होगा opioid का? In pharma you will study opioid का antidote जो है वो naloxone है. Okay. Physical examination reveals lumps. Lump मतलब पता क्या? Lump मतलब there are swellings like this. Okay. Lumps on his neck and face. ये देखो कहाँ पे है lumps? Lumps are present on his neck and face that are covered by small yellow color granules that are shown in the image. ये देखो ये है image. You see yellow color granules here. ठीक है? So these lumps are slowly draining yellow pus-like fluid. Yellow pus-like fluid. He says that these lumps have been present for the past several months. Chalo, ठीक है. All of you understood what is this thing? What will be the answer here? Anyone? Very good. You are already started answering. Actinomyces israeli. Actinomyces israeli. Hope all of you are clear with this. Everyone, before I go to the next important topic, everyone is clear with this. बताओ yes की no जल्दी फटाफट. Everyone. Very good. Very, 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 very good. Now, another important thing I want to tell you here. What is another important thing? We classified based upon catalase, urease, pigment producing, and the last important thing is hemolysis. Based upon hemolysis also, we will classify these organisms. Okay. based upon hemolysis, क्योंकि when I start bacteriology, there you will understand what is hemolysis, why it is very very important. Okay, so coming to the hemolysis, there are three important things. This you will study in every bacteria. Okay, I will come to it, Sultan. I will discuss it in a minute. Last में एक बार याद दिला देना मुझे. So coming to hemolysis, there are three different types of hemolysis. One is called alpha hemolysis, और एक होगा beta hemolysis, and तीसरा होगा gamma hemolysis. What are the three types of hemolysis? Alpha hemolysis, beta hemolysis, as well as gamma hemolysis. Now, what are these hemolysis over here? Just look here now. Let us say I have taken an agar plate. I have taken an agar plate. Okay. Now, what did I do? What did I do is that I have added 5% of sheep RBC. क्या ऐड किया मैंने? 5% of sheep RBC. Sir, why only sheep RBC? Why you cannot add human RBC? कौन देगा भाई? Who will give? Will you give your blood for this diagnosis and all? No, we use animal RBCs. Okay, we add sheep RBC. How much did we add? 5% of sheep RBC we have added. Now what I'm doing is that I will put a bacteria called as beta hemolytic bacteria. ये देखो, I am putting a bacteria called as beta hemolytic bacteria. Now listen carefully with both your ears open. ये देखो, I have taken agar plate, I have added a bacteria. अब पता है ये क्या होगा? Surrounding this bacteria, there is a pool of RBC. I am a bacteria. Surrounding me, there is a pool of RBC. Yes or no? All the RBC is touching everywhere, every inch of my body. Now what I do is I start releasing a very potent toxin called as beta hemolysin. What will I release? This beta hemolytic bacteria, this beta hemolytic bacteria, later you can write, just listen, will release a toxin called as beta hemolysin. Okay, it would release a toxin called beta hemolysin. What this beta hemolysin will do? It will cause lysis of all the RBC. All the RBC matlab, देखो, if I am standing here, I can only kill the RBC which are surrounding me. But can I kill the RBC which are present far away from me? No. I can only kill down, I can damage all the RBC which is surrounding me. So यहाँ पे देखो, what will happen here is that all the RBCs surrounding this are lysed. ये देखो, all the RBCs surrounding this are lysed. So tell me that if there are 100 RBCs surrounding this bacteria, all the 100 are broken down, all the 100 are lysis. So should I call this as complete hemolysis or partial hemolysis? बताओ, complete बोलूंगा इसको कि partial बोलूंगा? What will I tell? Very good. This type of hemolysis is called complete hemolysis. So such hemolysis is called as complete hemolysis. Complete hemolysis. Sir, what is an example? ये देखो. All of you look here, right? Everyone can look at this bacteria. ये देखो. In the center, this is the bacteria, right? Surrounding, यहाँ पे देखो, center there is a bacteria. Surrounding this bacteria, do you find any RBC? Do you find any red color thing? No. Surrounding this, there is complete hemolysis, complete zone of inhibition. All RBCs are dead. Everything is inhibited. So how is this looking? This is looking like a complete inhibition or a partial inhibition. It is looking like complete inhibition. Okay. It is looking like what? It is looking like a complete inhibition. So what is the color of this inhibition? When all the RBCs are broken down, what is the color which you see? एक है ब्लू, एक है ग्रीन, एक है गोल्डन येलो, एक है पिंक. What is the color you see here? Anyone? You see what is this color? You see a bright golden yellow color. Yes or no? Golden yellow color. So the same golden yellow color we have also seen exactly here also. है ना? So इसका मतलब क्या है? It means that Staphylococcus aureus is one example of beta hemolytic bacteria. It is one example of beta hemolytic bacteria. So now you are clear that if I ask you Staphylococcus aureus releases which toxin, you will tell that it releases beta hemolysin. So it is performing complete hemolysis. What it is performing? It is performing complete hemolysis. That is why the entire zone is golden yellow in color. All of you now understood this link which I've generated between both of them. Everyone is clear? Yes or no? Clear? Right. Very good. So this is what is complete hemolysis. Tushar, I will tell when I tell you gamma and alpha, you will understand the remaining. Okay. So till here you understood. Now, second important thing. Second important thing is that what I would do is again I'm taking the same agar plate like this. Okay. Now in this agar plate, again I'm adding the, let us say, sheep RBC, 5% sheep RBC I have added. Now after adding this 5% sheep RBC, in the center now I'm putting another organism. This organism is called as alpha hemolytic bacteria. This bacteria is called alpha hemolytic bacteria. Examples मैं बाद में दूंगा. Okay. This is alpha hemolytic bacteria. Now, what this alpha hemolytic bacteria will do, this would release a toxin called as alpha hemolysin. Beta hemolytic bacteria release beta hemolysin. Alpha hemolytic bacteria will release alpha hemolysin. एक बार रिलीज कर दिया, अब देखते हैं ये कितना डेंजरस है. Okay. Let us say I am alpha hemolytic bacteria. Surrounding me, there are 100 RBC. Out of this 100 RBC, I have a capacity to break down only 50 RBC. It means, should I call it as partial hemolysis ki complete hemolysis? Everyone should answer. Very good. This is called as partial hemolysis. Okay. This is called as partial hemolysis. Partial hemolysis. Just look at this. ये देखो. Surrounding the bacteria, if you see a bright white zone of inhibition, that is called complete. ये देखो, look at this point. First example. Surrounding this bacteria is coated in the form of beta shape, है ना? ऐसे मैंने छोटा सा stick लिया था, है ना? I've taken this stick like this, right? And you coat the bacteria, this inoculation wire or loop you take, coat the bacteria in the form of beta. Designed in the form of beta. Surrounding that, you see a zone of inhibition complete, not even a single RBC. This is beta hemolytic. Come to alpha. Look at alpha. Surrounding the alpha, you can see zone of inhibition, but very partially you can see. Yes or no? Look at gamma. Can you see any zone of inhibition? Beta, compare alpha with gamma. Surrounding alpha, you see some little bit shadow. But surrounding gamma, do you see any shadow? You don't see any shadow. So it means what I have to tell? I have to tell that beta hemolysis is complete hemolysis, alpha hemolysis is partial hemolysis, and gamma hemolysis is zero, no hemolysis or incomplete hemolysis. Okay. So here you need to know beta hemolysis, alpha hemolysis, and gamma hemolysis. Beta hemolysis is called as complete hemolysis, alpha is called as partial hemolysis, and gamma is called as incomplete hemolysis. All of you understood? Now, by this, you tell me which is the most powerful bacteria. Beta hemolytic bacteria are more powerful or gamma hemolytic bacteria are more powerful? Beta hemolytic bacteria are more powerful. So if I write down the order, beta is more powerful than alpha than gamma. Yes or no? Everyone is clear now? Tushar, you are clear now? Now let us discuss these examples. Okay. Now let us discuss these examples. Now examples are also very simple, guys. Coming to alpha, the first important thing is streptococcus pneumonia. This one you have to remember. Streptococcus pneumoniae. Second important example is, for example, let me write it as Viridian streptococci. Viridian streptococci. For example, let us say there where you are staying there, right? If you are staying in the flats and all, है ना. Flat में after 2 o'clock you cannot make the sound. Okay, if you are making, if you are playing, if you are putting the volume very too loudly and all, what will happen? The people there will complain, the police will come, you have to stop the music. So how will you tell this thing? So in that very moment, what will you do? Three things you will do. You might mute the songs. What will you do? You might mute the songs. What is might mute the songs? Might in the sense Streptococcus mitis. This is one bacteria. Mute in the sense Streptococcus mutans. And songs in the sense Streptococcus sanguis. You might mute the song. Streptococcus mitis, mutans, and sanguis. These are the three different bacteria. They belong to which group? Viridans group of Streptococci. Okay, Viridans group of Streptococci. So both of them, they fall under which bacteria? They fall under alpha hemolytic bacteria. Next, after alpha, the next thing we discuss is beta hemolytic bacteria. Okay, what is beta? B stands for BA. BAP, BA. Okay, so beta hemolytic bacteria are two. What is A and P? A stands for A galactaceae. A galactaceae streptococci. And P here stands for pyogenes. Pyogenes streptococci or Streptococcus pyogenes. Clear? Streptococcus pyogenes or pyogenic streptococci. Next, we have discussed the last important thing, that is gamma hemolytic bacteria. Where is this gamma hemolytic bacteria present? Gamma hemolytic bacteria is present within your intestines, right? So this is called as your enterococci, which is present in your intestines. So enterococci. So with the help of your intestines, only two things you do. You load the food, you unload the food. Yes or no? You load the food through the face or you load the food through the anus. How will you load the food? You load the food through the face, you excrete through the anus. So face in the sense faecium, and you are passing the feces in the sense fecalis. So there are two organisms that come under this enterococci. One is called as Enterococcus faecium. Another one is Enterococcus fecalis. So these are the two organisms which come under the gamma hemolytic. All of you understood everything I taught now? Everyone, be fast, fatafat. Tell me. Perfectly clear, everyone, everyone, everyone. Very good, everyone, everyone. Yeah. I cannot look at your comments. Chalo. Yeah, now I understand. Now I understand very nicely. Right? Right. Now all of you will diagnose and tell me, ठीक है? Case A. ये बताओ ये क्या है? What is this? What is case A and case B? Both of them same or both of them are different? बताओ what is case A and B? What is this A and what is this B? बताओ. Very good, very good. Gangrene. नहीं 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 Sultan, this is gangrene. This is gangrene. Okay. So A is dry gangrene, B is also dry gangrene. Okay. हमने वहां पे सेलाइन वगैरह ऐड किया था तो इसीलिए थोड़ा वेट दिख रहा है, बट इट इज ड्राई गैंग्रीन ओनली. So A is dry gangrene and B is also dry gangrene. Both of them are dry gangrenes over here. Clear all of you? Right. Now, you see this kind of hemolysis, this, right? What is this hemolysis? This hemolysis is called as partial hemolysis. Sir, identify कैसे करना है? How will you identify beta hemolysis? Very easy, golden yellow beta hemolysis. How will you identify alpha hemolysis? Wherever you see green color, wo alpha hemolysis hai. This is green, this is alpha hemolysis. Keep that thing in mind. Okay, write it down somewhere if you want. Now, another important thing I want to tell you is that we will discuss another important thing that is called as bacterial virulence factors. Bacterial virulence factors. What do you mean by bacterial virulence factors? See, for example, if you are going to a war, you won't go nakedly to a war, right? You will take weapons with you. These weapons are nothing but called as virulence factors. In the same way, if bacteria is entering into your body and damaging your tissues, bacteria will come with a full backup. This backup is nothing but called as virulence factors. इसमें enzymes होंगे, within this there are antigens, within this there are proteins, within this there are toxins, right? All these things together are called as bacterial virulence factors. For example, point number 1, the first bacterial virulence factor which I'm telling is IgA protease. Right? What do you mean by this IgA protease? Just look at this picture. Don't draw. Don't draw. Just look at this picture and understand. That's it. All of you know that this is your oropharynx. Okay. You also know this is your nasopharynx. Nasopharynx, oropharynx together join to form laryngopharynx from your anatomy. I'm not here to teach you anatomy. So if you look at these cells over here, these are the epithelial cells that are lining your nasopharynx. Now, whenever a bacteria is entering inside your body, either through oral route, bacteria will enter either through oral route or through nasal route. Now, bacteria has entered here. Now, this bacteria, it has to go and attach here. This bacteria should go and attach to the surface of the epithelial cells. Now, if it will attach to the surface of the epithelial cells, from there it will enter into your blood and cause the infection. But within your mouth, you have got saliva. Saliva hai na? Within that saliva, you have got a very, very important barrier. वो barrier का नाम है IgA. What is that name of that barrier? That barrier name is IgA antibody. What this IgA antibody will do? This IgA antibody will destroy that bacteria. ठीक है? But मैंने क्या बोला? Bacteria will come into your body with full backup. You know what bacteria will do? Bacteria starts releasing. It starts releasing an enzyme called IgA protease. It starts releasing an enzyme called IgA protease. What this IgA protease will do? It will kill down or it will break down this IgA molecule. So if it is breaking down this IgA molecule, don't you think bacteria can survive there for a long time? Right? So the question that is asked is, which is the bacterial virulence factor which is responsible for colonization of the bacteria within the nasopharynx? For colonization of bacteria within the nasopharynx, the virulence factor which is used is IgA protease. All of you understood now what is IgA protease and all? Everyone is perfectly clear? Yes or no? Be fast, be fast. We are out of time. We shall fastly end up the class after this. Be fast. From tomorrow, we'll start the staining methods. Right. Second important bacterial virulence factor is your M protein. Is your M protein. Abhi ye M protein kya hoga? What is this M protein? The important thing you need to know that, let us say this is a bacteria. This is your bacteria. Okay. Bacteria is having M protein like this. There is a protein that is located on the bacteria, that is M protein. Okay. Very good, Muntazir. Very good. Next, let us say you have got your beautiful heart over here. Let us also tell that these are your joints. This is your joint. Normally on the surface of your joints, and heart also, you have got M proteins. Normally they are present. M proteins hoga, aise. Right? Now you will call to your immune system. Let us say this is inside the body before the line is outside the body. You will call to the immune system and tell, so no, bacteria is coming inside, right? Now the immune system is worried. Immune system don't know which is a bacteria, right? Now you will instruct the immune system telling, So now bacteria is coming inside, right? How will you identify the bacteria? Is that if the bacteria is having M protein on that, that is a bacteria. Whatever structure is having M protein, वो bacteria होगा, go and damage the bacteria. Now bacteria has come inside your body. Now when it comes inside your body, your immune system is activated. What your immune system will do? It has got only one message in the mind that wherever I find M protein, I will go destroy that. So first the antibodies jitne bhi hai in your body, these antibodies will go like this, attack your bacteria. So bacteria is attacked. Not only that, your antibodies also will see that there are also M proteins that are located on the surface of your heart and joints. So don't you think your heart is also under attack by your own immune system? Your joints are also under attack by your own immune system, right? If your heart is under attack, you would end up a condition called as endocarditis. Endocarditis. Okay. If your joints are under attack, you would end up in a condition called as arthritis. Arthritis, right? So this entire condition mechanism which is happening right now is called as molecular mimicry. Molecular mimicry. Okay. This is like a suicide bomb. Okay. This is a molecular mimicry. So whenever there is endocarditis, you see, this is a normal valve. है ना? अच्छा ये बताओ ये normal valve है. Do you see infection here? All of you can look at the infection on these valves here. Yes or no? Be fast. Jaldi, jaldi, jaldi batao. Can you look at, these are all corda tendinae. Okay. Can you see the infection? Yes or no? Be fast. Very good, Syed Fatima. You can see the infection. Anyone? Yes. Very good. कहाँ infection है? This is not an infected valve. This is a normal valve. ये infected valve नहीं है. This is a normal valve. Okay, this entire thing is normal valve. अभी infected valve देखो, ये infected valve है. Can you see the infection here? Crops of bacteria, right? Crops of bacteria. ये देखो, always. Yes. So you can see crops of bacteria. You can see crops of bacteria here. Vegetations. इसको बोलते हैं bacterial vegetations. These are called bacterial vegetations. This is called as endocarditis. Okay. This is called endocarditis. Now, this is a normal joint. है ना? This is a normal joint which is very shiny. When the joint is infected, this is how it looks. ये देखो पूरा eroded joint. Joint पूरा erode हो गया. ये देखो बीच में. Yes or no? So this condition here is called as molecular mimicry. Now, sir, which organisms are having IgA protease? Those organisms I have already told you this. These are called as pin infections. You remember, pin infections are more commonly attacked in asplenics. So pin infections. Pin infections क्या होगा? P stands for, yes. You will answer now. Pin infections क्या होगा? P stands for Streptococcus pneumoniae. Next, I stands for influenza, Haemophilus influenza, and N stands for Neisseria meningitis. Neisseria meningitis. Clear? Streptococcus and these things. Right, guys? So all of you understood everything I have taught you today. Everyone, everything. Everything, all of you understood? Perfectly clear? Very, 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 very good. Very good. So tomorrow what we will do is that tomorrow we will discuss about these things. क्या होगा ये? We will discuss about tomorrow. ये याद करना पड़ेगा. Okay, you have to remember it. When you, Raj, when you have a capacity to remember the names of all the girls in the class, I don't think so remembering the names of each and every bacteria is much difficult. है ना? तो याद करना पड़ेगा. Okay, right. So all of you just look at this. All of you just look at this. That tomorrow, yeah, tomorrow, tomorrow what we'll do is that tomorrow we will discuss staining methods. Okay. So tomorrow we will discuss staining methods, and tomorrow we will also discuss है ना gram staining, Gill Nielsen staining, वो staining method कैसे करना है, all this gram staining कैसे करना है, all these things I will explain you very much clearly. Okay. In pin P about Klebsiella pneumoniae. Yes, pin is Klebsiella. You are telling pin organisms, Klebsiella pneumonia or Streptococcus pneumonia, right? Both of them, they come under this. There also, when I told pin organisms, not only Klebsiella pneumonia, even Streptococcus pneumonia also will come. No, Vamshi, I will send these PDFs in my Telegram group. है ना? मेरा Telegram group है Dr. Krishna Sahith official. You just type it there, you will find it. Okay, if possible. I think I cannot show it to you like this. है ना? I cannot show it to you. Chalo, I'll send it to you anyways. Okay. Clear, all of you. P chunk. I already told you about P chunk, right? In this P chunk, what is the thing that you want to know? P chunks are the names of the bacteria here, Sultan. Protease, Cryptococcus, H. pylori. These are the bacteria here which are releasing this urease enzyme. है ना? ये urease enzyme release हो रहा है. अगर urease release हुआ, you know, the environment will become alkaline and urinary tract infections will more commonly come. Okay, that is the reason why diabetic patients may urinary tract infections are very common, because the glucose there will completely alkaline. It will cause an alkaline environment in the urinary tract, so infections will very fastly come. Okay, I'll send you the group. Whoever haven't attended the previous lectures, just message me. I will send you one link. From that, most of the classes will be covered. Okay, only 2 classes is to hua. Chalo, fine. All of you take care. Goodbye and love you all. Goodbye, guys. Tomorrow we shall meet at the same time. Okay?